most important thing that's happening related to behavioral health and the work we do at Crisis Connections is the idea of having parity between physical health and mental health. And the fact is that they are integrated. And we know that more than ever. So there's a tremendous amount of attention being paid to not only the integration of physical and behavioral health, but the fact that right now the services available for people who have substance use disorder or mental health issues is not the same as the healthcare system available for people with physical ailments. So this is a really exciting time actually to be in the behavioral health field as a leader, because there's really attention being paid now to making sure that we have parity and integration between those two. So really the biggest work that we've been doing around access to behavioral health services has been the launch of the 988 line back in July of 2022. So it really is an expansion of the National Suicide Prevention Lifeline, which was for over a decade a 10-digit number. I couldn't tell you what that number was, and so to try to make it accessible, July of 2022, nationally we launched 988. So that is one of the first kind of big wins, is just making it more accessible to people, to have an easy to remember number to call. People define what a crisis is for themselves. That's, we say it's not, crisis is not defined by us. It's for somebody, it could be something as serious as contemplating suicide. For others, it's struggling with parenting a teenager. And so just first and foremost, just accessibility to help any time of day, 24/7, that's really been the biggest shift. And then coming from that as well is just making sure that we are looking at the social determinants of health and really working on best practices in behavioral health to really have people who particularly are most impacted in our community by racism, their zip code determines health, all those things, just taking a much more focused look at that and making sure that we have the right resources and right services for people in the community.